Today is March 23rd, and we're going to answer submitted questions from local reporters.
Hi, this is Dr. Terry Frankovich, Health Officer for Humboldt County.
So the Lost Coast Outpost wants to know, right now, what are the specific criteria local people are using to determine who gets tested?
It's a great question, and we've been in communication with the provider community. So we've outlined categories of individuals who are certainly prioritized for testing. So we want to definitely make sure that individuals who are either high risk by their exposure, for instance, to a contact or through travel, those who have a high risk occupation, such as healthcare workers and first responders, and in addition, those who the diagnosis would have a big impact on the setting in which they're residing. So for instance, someone who resides in a long-term care facility obviously needs to have a testing priority as well. In addition, they are able to look at things like the individual's risk factors in terms of their own personal health history. So those who are more at risk for serious complication. And we've made it clear to providers that if they have a patient in front of them where they're seriously concerned about the diagnosis of COVID, that they should contact us for testing.
Okay, great. The Lost Coast Outpost also wants to know, they say it's understandable that you only talk about confirmed verifiable cases, but given the shortage of testing capacity and the nature of the virus, perhaps you could also address what we don't know. Is it true that we don't know how many cases of the virus there are here in actuality, or whether or not there has been community spread?
So the only way we would know for certain about whether there are the total number of cases in the community would be if we could test everyone at a single point in time. And unfortunately, that is nowhere near a possibility. So we look at the same indicators everyone else has been looking at. We look for what is happening with patient activity within our emergency departments and hospitals. We test as many people as we feasibly can, particularly those who are high risk in terms of their symptoms or exposure. I do find it encouraging that we have, in the testing that we've done to date, and just in our own lab, as was reported, I think, over the weekend, we've tested over 100 individuals so far. The fact that we've tested individuals who have a compatible history in terms of their symptoms, who are in our community, and we have not had a positive case other than a single travel-associated case, I think is encouraging. Does it give us the entire picture? No. And we're operating as if there could be low levels of circulating infection in our community. That's just prudent and planning accordingly. Part of the reason that the social distancing is so important right now is because if there are low levels of circulating virus, the hope is to keep that from expanding throughout the community. So this is a pivotal time for doing that.
The North Coast Journal says Dr. Frankovich told us Tuesday she was hopeful that local testing results from LabCorp and Quest would be shared with public health by the end of the week. Has that happened? And if not, is there a new ETA on when public health will receive that information and when it will be made public?
So this seems like it should be a very simple thing to do, but in reality it ends up being a little more complicated, in part because the reporting systems are different. What I can tell you is that we are monitoring the California surveillance system. All the COVID testing is reportable. So we are monitoring that and monitoring certainly for positives. I'm hopeful that we're going to very shortly be able to present the commercial lab testing totals at daily, as we also present the in-house lab testing results.
Excellent.
So I understand the interest in that.
The North Coast Journal also wants to know, they say, understanding that public health isn't releasing case-specific information, can you tell us generally about what steps are taken after a confirmed positive case? For example, does public health make an effort to track down and notify confirmed contacts?
Yes, so obviously we are not in a time of rampant community transmission. So public health is still working very hard on doing identification of cases, identifying close contacts, notifying them, and having those individuals quarantined while they are monitoring themselves for symptoms. At some point when this infection is widespread, that no longer is very useful for us. However, right now it is.
Okay. KIM News Channel 3 says, are there any new coronavirus cases reported since Friday, and can you give an update on the patient?
There are no new coronavirus patients identified, and the patient is doing well.
KAEF News Channel 23 wants to know, what should I do if I have a fever or think I might have COVID-19 symptoms? Is there somewhere I should go or call?
So again, the message we've been trying to communicate to people is, while it would be lovely for us to test everyone who has mild respiratory symptoms, both from a surveillance standpoint and to reassure and help individuals make decisions, we really just don't have that capacity right now. So mildly ill patients should isolate at home until they are well. A good rule of thumb is 3 days after fever has resolved, or 7 days after the onset of symptoms, whichever is longer. So I really ask that individuals follow that guidance, and that will just, regardless of the source of their infection, will help to decrease spread. And I think it's practical in light of the situation we are currently in. We are constantly working to see if we can expand testing even further. But in the meantime, this is absolutely the recommendation we want people to follow. And frankly, even if testing capacity increases further, we are really still going to be looking for very mildly ill individuals to monitor themselves at home.
Okay. KAEF News Channel 23 also wants to know, they said over the weekend people planned a, quote, social distancing party in Trinidad. This causes the public to congregate in parking lots, etc. Many places are now seeing beaches swarmed with people. Does outdoor recreation while people are off work and school defeat the purpose of social distancing?
Well, I would say that certainly if people are assembling and not following the social distancing guidance as well as the shelter-in-place orders, that's absolutely a problem. The whole point of us all making this sacrifice is that it improves our odds as we go forward in this pandemic of managing it effectively. So I think it is our responsibility as residents to adhere to the guidance that is in place as well as the order. And while I really encourage people to be outdoors, getting some exercise, and just for the mental health benefits of being outside in our beautiful area, it is critically important that people adhere to the social distancing. The whole point is to not be bringing together people who are not together in their household all the time. That's how it works.
And I think you've pretty much answered this, but KIEM would also like to know, what message do you want to get across to residents?
Well, I think as we just said, I think that's one of the critically important things. Again, we are all making a sacrifice to make this work, and people, we count on each other to adhere to those policies to be effective. I also want to tell people, in addition, with regards to the testing question, that my recommendations about mildly ill people are very important to take a burden off our healthcare system, as well as to decrease spread within our community. I think that people who are more moderately to severely ill, or who have significant risk factors if with COVID infection, should be reaching out to their provider for guidance.
Great, thank you so much, Doctor.
Thank you.
Appreciate it.